when you inform them and they get it, they can't take the medicine correctly, or the problem they had for a couple of years and you can solve them. It's valuable for me.
Welcome to PharmaTalk Podcast, brought to you by pharmacy students. Hello, I'm Nisha.
And I am Om.
Yeah, Om, so today what is topic that we are going to talk about?
Topic today we are going to talk about community experience as a pharmacist.
Yeah, because when we are in year 3, we have like a small experience that we go to the รอบ hospital or
Yes.
a small hospital.
Yes,
So
small.
the full name is
The full name is vary. ศูนย์บริการสาธารณสุขโรงพยาบาลส่งเสริมสุขภาพตำบล is so long name, so we will call it primary care unit for short. Okay.
Yeah, for today we are going to talk about just primary care.
Yeah.
Most of people will know about pharmacists that they are in the drugstore,
Yes.
but there are more than that.
Yes.
Yes.
We have the pharmacist in a primary care unit, but in some place full-time, part-time,
Yeah.
it's individual place.
Yeah.
Last summer, the third year as a pharmacy student, we went to the primary care unit to first practice as a pharmacist. So it's good experience,
Yeah.
right?
Yes. Of course.
Okay.
Because guest today she is the one that I worked to that at the last summer, and it's very good experience for me. Yes. The
Yes.
first experience that is very important to me, and also I'm very impressed with that.
Yes.
Yes.
So our guest today.
Yeah. Very gorgeous girl.
Yes. Our guest today เภสัชกรหญิงอัชราแสนศรีสวัสดิ์สวัสดีครับ
สวัสดีค่ะ
สวัสดีครับ
ค่ะ สวัสดีค่ะ I'm Ben. Hi Nisha and this is
Om.
Om, right? Nice to
Yeah.
meet you, Om.
Nice to meet you too.
This is first time that you got
Yeah.
met each
Yes.
other.
Yeah.
Yeah, because I met her already in the last summer, 10 days.
10 days.
I went Lampang
Primary care unit.
primary care unit at
in
Lampang.
Lampang.
Yes.
It's an honor that you'll be here. Thank you so much.
Thank you so
Thank
much.
you for inviting me.
Yeah, so first, I would like to ask about your job now. What kind of job that you're doing now?
Okay. I'm a pharmacist at Suthep Sub-District Municipality. It's kind of public health service center. It's primary care units, as you know.
What is a pharmacy role in there?
Okay. My major role includes medicine dispensing, inventory management, and home visits for
home visit.
patients who have drug-related issues.
Mm.
Yeah. And furthermore, about consumer protection covers health product shop assessment and public awareness raising, like rational drug use.
Can I ask you what is rational drug use?
It's kind of promote people who use medicines in right way.
Like antibiotics.
Yes, antibiotics must use like this.
So before we going through the main topic about community pharmacist, I would like to ask about your studying. Where did you graduated?
Okay. I graduated from Faculty of Pharmacy in Chiang Mai University with both bachelor's and master's degree.
So I misunderstood. At first I thought she's from Phayab University.
Okay. I've been worked there
You've been
at
worked
Phayab
there.
University about 1.5 years.
Work as a pharmacist.
Work as a lecturer.
Oh.
ก็คืออาจารย์
อาจารย์
Yes.
And when you are in the university, what do you like the most in all of the 6 years?
Okay. When I was student, I studied for 5 years. It's the second generation or second years that we have both 5 and 6 year that student has to be choose. But I chose 5.
Oh, that's very good.
I like the most is activities and friends.
Yeah, me too.
It's not all about study.
And which subject that you interested in?
I liked pharmacology.
Pharmacology.
And anatomy. I liked pharmaceutical science subject, but I didn't choose it because the trend on that last long year is trends to be pharmaceutical care.
I see. So, but now it's quite the same.
Yes.
The trend. Yeah.
Yes.
American trend. Not sure.
So before you are coming to the community pharmacist, what is your job after you being the lecturer?
I will tell you at the beginning.
Okay.
After I graduate, I have been a medical representative, and next I've a pharmacist at pharmacy store. And then I worked at Bangkok Hospital at Pitsanulok. I work as a inventory manager.
Oh, so what is in Thai?
หัวหน้าคลังยา หัวหน้าคลังยา and เวชภัณฑ์ The third job is the lecturer at Phaya University. And the last and the present, a pharmacist at Suthep Sub-District Municipality.
So we are going in the main topic of this episode is about community pharmacists.
What are different between pharmacist in primary care unit and pharmacist in secondary and tertiary unit?
Pharmacists in primary care units, we work closely with people more than secondary and tertiary units because of smaller scales of people. We take care of it. We need to visit people or patients who have problems with drug or health products. But pharmacists in secondary and tertiary hospital, they don't have much time to take care of people in individual like we do in primary care units. We have to take care in person by person. Like this patient have problems about reading. You will notice that in the hospital or in the big hospital, pharmacists don't have much time to talk or counseling with patients. But in the primary care units, we need to talk with them more and find out what the problems they have, like can read Thai or can read any languages. We need to find the solution that how to make them can take medicine.
What is the problem that for you it's the hard things to solve, like the compliance of patients?
In every other patient have different problems. Some problems can solve with professional provider, but some problems cannot. They need the collaboration with her family or any other profession. Like we need the doctor, we need the nurse who solve together, and it's our role to collaborate with them.
I want to ask what is advantage and disadvantage about being the community pharmacist?
For pharmacists in primary care units, it's really useful for patient. Our profession is valuable, and the patient will know me really closely. We can remember most of patients in the hospital. If you will dispensing the medicine, you will call your the full name, right? The name and full name to correct that the patient that is the patient or not, right? But in the primary care unit, we just meet each other. I just see her face and it's she or he.
Because
So what about cons?
Because of catchment area is smaller. Maybe in your career path, you may feel like you can't
Like
grow
up?
higher, but you can. They are primary care pharmacist role now. We try to make it like show up clearly for our profession.
So if you want to recommend the pharmacy students who want to be in the like a primary care pharmacist, what are the things that you want to recommend them?
If you are interested in working with people in community, working with volunteer, or also more, working with the leader of the village or ผู้ใหญ่บ้าน and work closely with people, you can be a pharmacist in community like me. Consumer protection in primary care units. Our role is about health product shop assessment, like groceries or restaurant. Restaurant we assess about food safety.
So I've heard that the one that called bolus in the groceries, which in Thai is ยาลูกกรอน Have you have any experience about this?
I see most it's like handmade pills that there are five pills and 3 colors. And we know that they're made from Lampang. Maybe it's stigma from this province. Maybe it's not from Lampang, maybe it's from others. But it seems to be stigma for that. It contains steroid, as you know, and it's illegal to sell that.
why people love to use it?
They need them because it can help about pain. It is painkiller that most effective. But as you know, they are dangerous as drug effect.
Why they don't go to the pharmacy store?
Because the pharmacy store can sell it. Why it's not allowed? And they need the prescription from the doctor.
And they don't want NSAID or other analgesic.
Because the steroid is more effective.
And faster.
Yeah,
Can
faster.
treat faster. They like sometimes if they want to treat this pain, they don't care about the adverse effect. Yeah.
As a pharmacist, we have to inform them. And it's effective, right?
We need to deal with the grocery owner and like awareness raising to people or patients in community.
From my experience as a pharmacy student in community primary care unit, I feel that I cannot handle with some people have psycho problem. It's challenging to communicate with them. You have experience with that?
You made a chance that you have to deal with people like this. We have a role to refer them to specialists. Primary care unit role is just we have a role in basis if it's more than our abilities. Can refer them to secondary and tertiary units.
For me, in the ศูนย์บริการสาธารณสุขตำบลสุเทพ that I work with พี่เบน right? I think the most experience that I got from the home visit, I just know that some of people that they have misunderstood about the supplements and their diseases. They are dyslipidemia. So his son, like do you know ข้าวขาหมู his father really liked this menu, and his son gave this menu to him, and he gave the fish oil and garlic oil that make that it's fine. He can eat this. Yeah, so there are many things that patients and also their family misunderstood about this. Yeah.
So that's why where the medicine or health product is, the pharmacist should be there.
Yes. Yes. Can I ask you something? What make you happy as community pharmacist?
This profession is valuable. You feel like it's fulfill your mood, your feeling when the patient like get it. When you inform them and they get it, they can take the medicine correctly, or the problem they had for a couple of years and you can solve them. It's valuable for me.
So today it's all the time.
Yes.
Yeah, it's very nice to talk to you, Huben, and let's go to the next part.
Don't forget to like,
Share.
And subscribe our PZ channel. Bye.
Bye bye.